When I was invited to become a board member, I actually hadn't read the journal, BMC, Medical Informatics and Decision Making, and I looked at it and I thought actually that's quite a useful resource. It's actually quite a good journal in a field where, although there are a number of journals, there isn't really a particularly preeminent one. It's a field that people have different attitudes to, and the journals have different flavours. Some of them are more theoretical, some are more practical, and I think the stance that BMC, Medical Informatics Decision Making, takes, it suits me. I think it's one that I look at, and one that I'm pleased to be associated with as a board member, and also to be published in. I was surprised, I think, at just how rigorous it was, actually. The piece of work that I submitted recently, it wasn't actually, in the sense, a fantastic piece of work, and we weren't sure what was a good place to try and publish it. And then I was very surprised when we got the sort of quality and level of feedback we did, and actually know this, if we can deal with all of these comments, could actually be quite a good paper. I mean, there were some very good reviewers who'd actually approached the job very thoroughly, and I think we'll benefit a great deal from that. We had a project in which we'd been invited to provide a piece of software to facilitate a clinical trial, and we wanted to describe the experience of creating that software using approaches which had been discussed in the health informatics literature. But it wasn't a particularly big breakthrough in research. It wasn't a project for which we'd been funded and been able to put much effort into. But we felt this was a useful experience and something we wanted to describe. But it's actually, that kind of paper is quite a difficult paper to write in a way, because you're not describing a classical experiment. You're reporting experience which you think is useful and should be shared, but it doesn't fit the norms of how scientific work is reported. I mean, some journals would actually be quite happy to just publish it as it was, but the reviewers for BMC came back and said, no, this is interesting, but you really haven't met the standard that's required for a scientific publication, and actually suggested some very concrete things we could change that would make the paper appropriate for publication in a reputable journal. And I was pleased, partly as the author of the paper, but also partly as somebody associated as an editorial board member with BMC, that I thought, actually, no, this is good, this is quality reviewing. So having had the experience of submitting something and getting very useful feedback, definitely it's a journal that we would consider for perhaps some higher profile pieces of work that we want to publish in the future. Well, a lot of the work we do in health informatics is about access to information, so it's something that we think about perhaps more than other scientists, and so the idea of publication where you've got no economic barrier for access is actually very appealing. And it's also the case in a field like health informatics, which is a small field, that you're going to get, and a rather sort of disparate field, that there are going to be lots of people who aren't in a position to get access to a library that's going to be able to subscribe to a wide range of journals. So you'll have people publishing in 4 or 5 specialist health informatics journals, but also in clinical journals and perhaps in computer science journals. And so I think somebody working in health informatics, not as blessed as we are at UCL with very good library facilities, might find it difficult to keep in touch with everything that's going on. So from our point of view, open access is a great way to publish. So one of the fields where I'm active as a researcher is clinical decision support systems. So we're looking at systems which have some information or knowledge in some form to which a clinician can turn in help making decisions. And one of the things we've become more interested in over the years is the idea that the knowledge in the machine should be based very closely on that in the literature. And so as search engines evolve, you start to think, well, actually maybe the decision support is actually a kind of intelligent search engine that's helping the clinician find the evidence out there in literature. And so you can think of this kind of computer-assisted evidence-based decision-making as much as decision support. So we're very interested in journals which are able to make their content available in a form which can be accessed as part of a computer-based decision support tool of some form. We're talking to various journals and knowledge providers, if you like, about that kind of thing at the moment. And so one thing that's changed in recent years is that patients have, through the internet, been able to have access to a much greater variety of information about healthcare and conditions than they had before. And it can be quite difficult for clinicians who, when they first encounter this, that they'll get a patient coming to them with a sheaf of things they've downloaded from the internet saying, well, why aren't I getting this treatment, or why aren't you dealing with the problem this way? But actually it's a tremendously empowering thing, and I think once clinicians get used to it and learn how to deal with it, then it's a very positive development. And it's particularly true, I think, in chronic conditions, because you can get a lot of patients now. I mean, a lot of the model in healthcare has been developed for acute conditions. I mean, the sort of model is you fall ill, you go and see the doctor makes you better, and that's that. Whereas increasingly healthcare is about the management of chronic conditions and about risk. And so you'll get patients who are dealing with their situation for year after year after year after year. And they could quite easily, if it's an unusual condition, come to know a lot more about it than a general practitioner who they might have to deal with. And so the problem of the informed patient is something that's of quite general interest. It's certainly the case that in medical imaging, people want to publish very high quality images, and that's difficult and expensive to do in a conventional journal. So you either pay for pretty expensive printing costs, or you miss out on some of the pretty pictures. So there is a lot more use made of the things that you can do in electronic publishing that you can't do in paper-based publishing. Here at UCL we run an MSc program in health informatics, and as part of that students have to do a dissertation. We had one very good student recently who did a dissertation where they took a set of equations for cardiovascular risk and combined those with statistics, just the UK survival statistics, to create a model that would predict risk of death through a cardiovascular event. And he wrote that up and published it in BMC Decision Making. And in order to build these models, we've been trying to get access to data from a number of clinical trials. I mean, there's very well publicised longitudinal studies that have been done, and you can look at the results of those, and you can use the equations and the information that's been published. But actually, for a lot of what we want to do, we want to get at the actual data. And what we found is that some of the original trial data, sometimes the people involved in the trial are willing to let you share it for a fee, and that starts adding up, particularly when you're talking about the work of a PhD student. Some of them aren't prepared to share it, but are prepared to collaborate, so that you can have access to the data, but they can't give it to you, but you can come to them, and maybe there's some computations that they can help you do, and then a shared publication can come out of it. But actually all of these models are slightly restrictive, and you think, where's the public good, or where's the benefit to the person who originally funded the research and all of this? Is it appropriate that the data should be held onto by the people who are responsible for the original trial?